In today's video, we're going to talk about 10 skin problems in diabetics and signs of diabetes that can cause them, affect your skin, and besides that, I'm also going to show you a supplement that can be a powerful ally in the content about the subject of your blood. And these signs and symptoms that I'm going to bring here, they indicate either diabetes or insulin resistance. What is a striking feature of this? And the skin is just one of the organs that can be affected by diabetes. My tip for today is watch the whole video, because I promise you that you will learn something cool, something useful and amazing for you and your family. This becomes more important if we have number 1 fact science that diabetes is a silent disease. So 40% of diabetics do not know they have diabetes. And the skin problems can be the first signs. So look, hit the like button, subscribe to the channel, and share this video because sharing health is an act of love. And also leave a comment from which part of Brazil or the world you're watching me now, because I want to get to know you better. The 10th sign, the 10th skin problem is what we call chantelasma. It is a yellow plaque that is usually located here on our upper eyelid, usually near to nose. And it is painless, that is, it does not cause pain and the growth is slow. And this chantelado is nothing more than a yellowish fat plaque that is related to the increase. The
triglycerides
and also cholesterol. Okay, good skin lesion, microbiosis, lipidica, which are yellowish, reddish or brownish spots on the skin that accompany especially the tools. And they are injuries that as they evolve, they develop a relief, are rounded and hardened. And the skin around this lesion, it becomes brighter, as if it were the shine of a porcelain. And the blood vessels may become apparent. The skin could also be irritated and inflamed. And this lipoid necrobiosis, it can go through periods of activity and also for a time. And also of remission. So there may be a time when the person is with it, some time has passed, she disappeared and then came back again, and this problem, as it evolves, it can even cause skin atrophy. The skin can become depressed like a valley, a little holes. It can cause itching on the skin, and it also increases the risk. Or is it a very serious problem? And it's relevant in day-to-day life. The 8th sign are skin blisters. Blisters similar to burn ones. So it may affect feet, hands, hands, legs, and arms. They're not painful, but I ask you, don't puncture the bubble, as it increases the risk of infection. And diabetics are at the highest risk of infection, which is exactly our settling foot problem, which are skin infections, which can be fungal, bacterial. It can't be the staph, for example. Here in the region of India, it could be a folliculitis, it could be a nail infection, or even a recurring vaginal candidiasis, which is very common in patients with diabetes. And these skin infections usually affect the warm and moist folds because it is more conducive there. Crowd. The 6th skin problem is eruptive xanthomas, that are yellowish papules, like pimples. They can be yellowish or reddish and usually have a halo around the lesion. And they appear quickly, especially on knees, buttocks, elbows, chest and abdomen. Like I said, they look like pimples and mainly affect men with type 1 diabetes, high cholesterol, and so on. And when we control these risk factors, these little spots, these papules, these pimples, they can disappear. Our skin problem kilo is diabetic dermopathy, which are dark spots on the shin that look like tongues. They cause an almost imperceptible depression in the skin. and about 55% of diabetics have them. And these spots, generally, they are bilateral, affecting both shins and look. They're not age spots, so they can disappear. So many people think they are age spots, but then they disappear. So they're not age spots. The beach dermatopathy. In fourth place, for skin program sclerodactyly.
Because as the diabetics
The
hand
skin can get harder with a wax-like appearance, and the joints can become stiff and immobile. It usually doesn't cause pain and affects about 1/3 of type 1 diabetics. And over time, it can generate a feeling that the person has little stones between the 2D joints. Third skin problem are the skin tags, which are very similar to wart skin lesions that usually appear on the arm, neck, axillae, and also navi. Going and are an indicator of insulin resistance and should be treated by a dermatologist if they end up bothering from an aesthetic point of view. Second skin problem, this is one of the most common, if not the most common, which is acanthosis nigricans. They are dark spots on the skin, spots with a soft aspect. It's cold and velvety and it's not dirt. So you can see that person here at the fold of the neck, here behind the nape, here on the cheek, here on this part. There's a dark spot. You say, wow, the person doesn't even scrub in the shower. No, that's not dirt. This is acanthosis nigricans and indicates insulin resistance. As I mentioned, it's primarily present in folds in the nape, in the neck, on the eyelid, on the rod, on the cheeks. So it's an indication of pre-diabetes or diabetes. And the number one or most common skin problem is dry and itch-prone skin, skin that lacks skin. It itches. So the skin of a diabetic is usually drier and more fragile than normal. And this can even increase the risk of diabetic foot, for example. That skin that is more fragile suffers an injury. And that person who does not have the sense of touch pain, so refined because of diabetic neuropathy, continues to injure that wound. This injury evolves and it eventually causes what is known as diabetic foot. Literally nightmare. And this dry and prodigious skin, it is caused by excess glucose in the autonomic nervous system, which ends up affecting the production of sweat and blood, which is a kind of oil produced by the sebaceous glands to hydrate and protect the skin from external agents. So when we don't have this protection of our skin, there is an increase in risk.
the further
Diabetic,
okay, the supplement that
What I promised you is this supplement right here, because berberine is generally used in the dose of 300 milligrams per day, and it can help a lot in consumption. Control the level of sugar in your blood and also the control of your body weight. And once controlling your body weight and controlling your blood sugar levels, it can also help you in mainly control of type 2 diabetes, which is the most common diabetes. Typically around 90%, even more of the cases of type 2 diabetes. So did you like Perpivir? It's important that you acquire it from a trusted supplier. I left the link there, first link in the description, for you to contact the analytical pharmacy, which is the pharmacy I use, which is the pharmacy my mother. If you say that you're from Dr. Joan's channel, you'll get a super ending.
Goodbye.
It's a tail in the acquisition, your barbershop. So click there now, first link in the description, if you want to treat your diabetes naturally. Maybe you will be able to, can drop the average individual
either
out
increase or decrease the
on
level.
use of insulin, because I've already achieved this in several of my patients. Look, don't go away, stay here with us as I've prepared two very special videos for you. This one about a drink, a tea that can help lower your blood sugar, and this one about the best and worst fruits for diabetics. Okay, a big hug for you and your family. Stay here, stay well, stay with us.
See you next time.